To call on the Minister of National Security.
Thank you very much, Minister Cox, my cabinet colleagues, Minister Dayal Singh, Minister Robinson Regis, members of the media, wider viewing and listening public of Trinidad and Tobago. This morning, I've been specifically tasked to deal with a number of items that are affecting us today. First, I'd like to start off by assuring you that all of the measures that the government has taken and will continue to take, especially at this stage, are to protect the persons here in Trinidad and Tobago. This virus, as surely by now we've all realized, respects no boundaries. It respects no races, it respects no nationality, it respects no religion, it respects no age, it respects nothing that is human. The virus is a highly contagious one that we have seen spread across the whole globe, and we in Trinidad and Tobago are not immune from it. The Chief Medical Officer gave a very important message a short while ago, and I'd like to just refer to it briefly. He said we are at the tipping point. And that is a very important message that he gave us. The reason that the government took to close our borders is because we want to protect everyone who remains here in Trinidad and Tobago. The closure of our borders brings us absolutely no pleasure, but it is specifically been done at a fairly early stage compared to a lot of other jurisdictions that are now crumbling under the runs on their healthcare system to protect you, the persons here in Trinidad and Tobago. If persons find their way through this border, whether it be via action, including court action or not, understand that it is going to affect everyone. Understand that at this stage, as the CMO and the Minister of Health and the other healthcare professionals have told us, the cases are all imported cases. Persons returning to Trinidad and Tobago, especially through international airports, present those risks to us. And that is what we are now seeing manifesting themselves around Trinidad and Tobago. So far, all of our exposure has been from people returning from abroad. Hence the reason to close our border, and to close our border in a very short time frame. Not a time frame that suggests, well, give until Tuesday, give until Wednesday. The government took the decisive action to close the border to protect all of us here in Trinidad and Tobago. What we are asking our citizens who remain across the globe in certain positions is take shelter where you are. Take shelter where you are and focus on your self-preservation where you are and looking after yourself. Reach out to our various embassies, consulates, etc. that we have across the globe. Let us know where you are and let us see what can be done where you are. If we have to open our borders, understand that is the end of hope from a medical perspective. And that is a very important message. Understand that if the borders are opened, it now puts all of us remaining here in Trinidad and Tobago at considerable risk. We have seen the suggestion and the threat of going to court. That is not something that the government takes lightly. And I dare say that is not something that the population takes lightly. The persons who are currently in Barbados, we understand is about 33 persons, took very calculated decisions to leave where they were after our borders were closed in Trinidad and Tobago and to attempt to make their way back. The borders were closed to protect all of us. They made their way to a sister CARICOM country, Barbados. Before they left Oman, before they left South Africa, to Oman, Oman to London, London to Barbados, they were aware that our borders would be closed and they would not make it back in time. Barbados has implemented a 14-day mandatory quarantine period we went a step further and closed our borders to non-nationals and then now to nationals as of midnight on Sunday. And I emphasize again, to protect the remaining population here in Trinidad and Tobago. Every single country, and we're seeing it in the United States, in certain states, has limited bed space. And what we need to do is to flatten the curve and keep the curve as flat as we can. We've heard from the Minister of Health and the Chief Medical Officer the daily effects that imported cases are having here in Trinidad and Tobago. If the court was to order that persons be allowed in, that would be the end of the protection that the government has very carefully put in place to protect people in Trinidad and Tobago. And it would defeat completely the closure of our borders. We are in contact with our CARICOM sister Barbados. We will continue to have conversation with them. We thank them for their 14-day quarantine period. And what I'm going to say here now with respect to those specific cases, and the only case there, is if those persons, after their quarantine period in Barbados, do not present any symptoms of COVID-19, the coronavirus, and they make their way to Trinidad, they will be put into quarantine by the state. We need to keep our border closed and to continue to protect all of you, the population who are now within our borders here in Trinidad and Tobago. Understand that it cannot be a loophole that we accept that persons make their way from wherever they are in the world on the few remaining international flights to any CARICOM country, including Barbados, and then think that that is a jumping point to break the barrier that we've put to protect the population of Trinidad and Tobago and the people within our borders. The government is resolute that it will not allow that, and it will do all that it can to continue to protect you, the population that are here. Once a CARICOM border is open with access to Trinidad, we have no more border protection. If we leave this open, any person who is sick can go on a plane in the United Kingdom, head to Barbados, and because Trinidad and Tobago is closed to protect us from this situation, they can then attempt to get through our border like this. The government is resolute that we will continue to protect the population, and we're not going to permit that. After seeking advice, and you heard the Chief Medical Officer say it a short while ago, if these 33 are provided with an exemption, once they don't present with symptoms within the quarantine period in Barbados, and we're not going to be bringing them home. If they present here in Trinidad, they will be quarantined by the state for another 14 days to protect the population. I want to repeat that the virus knows no boundaries. The virus does not care who we are as a population. We're seeing it happening all over the world. Persons who we may consider celebrities, persons who we may consider privileged people, getting the virus, and the same happens in Trinidad. We took a decision to close our borders. We took a decision very early o'clock and have been taking decisions to protect people. And that is one of the positions of the government, and we will continue to do so. Even though we've closed our border, it appears as though there's some people in our society who continue to want to put the rest of us at risk. The rest of us who are exercising our social responsibilities at risk. There's certain irresponsible people who continue to want to push the boundaries. The boundaries are not boundaries pushed on the government, are not boundaries pushed on the CMO, but those are boundaries pushed on we, the population of Trinidad and Tobago. So those irresponsible people who continue to want to threaten our survival as a country and our success in protecting you, the people of Trinidad and Tobago, we will not permit that to happen. We will do everything within our power and reasonable to not permit that from happening. We will not be using CARICOM airports to defeat our entry. It is either we are in or we are out. And that is a clear message today. It is even more dramatic and dangerous to us here in Trinidad and Tobago when CARICOM countries continue to have that international travel with the threat to then catapult them into Trinidad and Tobago. And the government is resolute that that cannot be permitted because we need to protect all of us here in Trinidad and Tobago. There is some misinformation being carried out there, particularly on social media, with respect to the persons who are in Suriname. On Saturday, I, as the Minister of National Security, gave very clear instructions very early in the morning on Saturday night and very early in the morning at 3 o'clock in the morning on Sunday to Suriname Airways that they could bring our nationals home because we had not yet locked our borders. Suriname Airways was unable to carry their flight on Sunday before we closed our borders because they could not get a crew to fly their plane. So the suggestion that the government of Trinidad and Tobago somehow prevented it is completely untrue, and I'd like to correct that. We gave all permission. I ensured that our permanent secretary at the Ministry of National Security reached out to Suriname Airways directly and told them I granted permission for them to come and bring our citizens from Suriname home before we closed our borders. Suriname Airways could not get a crew. I was just informed by our embassy in Venezuela that so far it is 17 people that they've located, 16 in Margarita and 1 on mainland Venezuela. So they're dealing with the number of 17. As I said earlier, any of our nationals anywhere in the world, please contact our embassies or high commissions, this type of thing. But understand that our decision to close our border remains. How we deal with these 33 people in Barbados, as I've said, let them complete their quarantine and then we will consider, but we are not sending for them. And if they come here, they will be quarantined again for 14 days by the state. The important point that the Chief Medical Officer made to us in advice is once you enter an international airport, once you go on an aircraft, you are now presenting yourself to fresh risk. So you could go through all the quarantine in the world. You enter an airport and you enter onto an international flight, you are now back up to maximum amount of risk. Look at what is happening in the state of New York. Look at what has happened now in New York City, which leads to my final point, what the CMO touched on about using the Quarantine Act. Persons who have traveled to Miami, to New York, to all of these international airports need to self-quarantine. Moving around, as we've seen happen, by personalities, that has led to serious contact spread risk. It does not respect, the virus does not respect our status or what perceived status you may think you have in society. To say that you don't think this could have happened to you when you've tested positive is of no use to all of the people that you have put yourself into contact with when you should have been self-quarantined. We are going to be taking very strong positions with respect to that. So please, population of Trinidad and Tobago, be assured that the government remains resolute in doing all that we can to keep our borders shut. And the threat of court action means nothing when you allow persons to break your borders and to now infect via importation the rest of us here in Trinidad and Tobago. Our system, our medical healthcare system, and I take my hat off and I give salutations and high respect to the Minister of Health, the Chief Medical Officer, and all of the personnel who have been working. I was retracing it since last night, since before December when this started. The Ministry of Health has been working to build that parallel healthcare system and have done a tremendous job. But as you saw with the return of the persons from one cruise ship, now 44 persons are taking up those bed spaces. Understand, every person who imports right now from an international airport on a plane adds an additional risk. And I will say this without fear of contradiction. Persons if they are allowed to penetrate our borders at this stage. Because right now we don't know with any certainty what we're dealing with within our borders as more cases present can very quickly overwhelm our medical healthcare system. The same way you're seeing happening now in the mighty United States has happened in Italy and other countries of the world. Pay heed to what's happening in the United Kingdom, United States, as we as a globe join hands with everyone in the fight against, not literally, in the fight against COVID. We will continue to protect you by keeping our borders closed. Thank you all very much.
Thank you very much, Minister of National Security. At this time,